Good afternoon, everyone. My name is Dr. Eliane John, and I'm talking to you from Coral Springs here in South Florida. The title of my presentation today is Empowering Female Patients, the Aesthetic Orthodontic Trends and Confidence. So I'm super excited to talk about this topic because with our bracket system and protocols developed by Dr. Pitts, we can definitely deliver the best smiles in this world. It's just absolutely fantastic. So I hope you enjoy my presentation. But first of all, I would like to talk to you a little bit about myself. So I was born in Rio de Janeiro state in Brazil, but I was raised in the Amazon. Believe it or not, I used to jump from ropes across the rivers. I had a monkey as my pet and used to have lunch with the Indians. So it was a quite childhood. I didn't know it was so unique until, I came to civilization, let's put it this way. Then I went to dental school in Brazil, and I practiced dentistry for 6 years before moving to the US. When I moved to the US, I went to UCSF, the International Dental Program, for 2 years, and then went to University of Detroit, Michigan, for my certification in orthodontics and master in science. Michigan's a lovely state. People are super nice there too. But it's very cold for Brazilian. So I moved to Florida in 2011, and I opened John Orthodontics in 2013. In 2020, I did Pitts Masters, and that was a game change in my practice. I highly recommend any of you to do the course with Dr. Pitts. It's a 2-year course, unbelievable speakers. Dr. Pitts is absolutely amazing, and you're going to be able to see orthodontics in a different way, as I did. So I have 3 passions in my life: my family, orthodontics, and traveling. So this is my family. My daughter Isabella, she's 17 years old. My son is 15. Anyway, you find out that you are kind of getting old when you become the shorter one in your family. And again, traveling. So we travel all over the world. It's my favorite thing to do. And I really like to be in places that I have never been before. I like to see different cultures, language. Again, I love to be out of my element, always trying to see something new. And I think I do the same way in orthodontics. And that's the reason that I pretty much changed my whole bracket system for Pitch 21. So before I start my presentation and what we can do to help our patients age gracefully, we're going to talk about the aging phase. So this photo was taken from Dental Economics, July 2019. And you see a 23-year-old and her mom, a 60-year-old woman. And when you look at their face, especially if they look at the smile, you can see in her daughter a full incisor display, right? A broader arch. You cannot see that in her mom. In her mom, you see the arches are constricted. You cannot see the full incisor display anymore. And that's because of the aging phase. As we get older, our nasal tip drops, moving down. Our lip thickness kind of disappear, including our cheeks. So those are definitely aging signs that, thank God, we should be grateful enough that we are aging, right? And of course, the nasal labial change. You can see the nasal tip descends and rotates, and there is a clockwise rotation of the nasal labial complex. So, smile arc protection. So, smile arc protection was developed by Dr. Pitts. So, I'm sure all of you guys have heard about Dr. Pitts because he's not only the most amazing, best orthodontist in the world, but he's also a very humble and kind man. And I'm very grateful for everything he had provide to our profession. okay? So Dr. Pitts not only developed the smile arc protection, but also a bracket system called Pitts 21. He helped in the creation of Damon in the 2000, but he created his own bracket, Pitts 21, and now Pitts 21 Pro, that we're going to talk about it during the presentation. But anyway, why is that important to talk about the smile arc protection? And what is a smile arc protection? So the smile arc protection is the preservation of the natural curvature of the smile that is already present, which tends to flatten during the traditional orthodontic treatment, or to create an aesthetic smile arc when one is not already present. I don't know about you, but I always consider myself a good orthodontist. I think I get good occlusal finish, good overbite and overjet, but I was very critical of myself. So going back to my case, I always thought that when I finish a case, sometimes the patient looked better in the beginning. And anyway, that got resolved for the first time I saw Dr. Pitts in one of those 2 days course during the weekends. And when I saw his work, I was like, oh my God, this is what I'm been missing. And this is what I want my patients to have. So how is it done? So the way we custom place the brackets higher, right? So this is the traditional approach. This is our approach. So our brackets are higher, see, mainly the incisors, and they have to follow the curvature of the lower lip. So the questions we always get, what about hygiene? What about the torque? Nothing gets affected, okay? The hygiene, if the patient has a bad hygiene, you're gonna have with the brackets, even in the incisal edge of the teeth. If you have to get the decalcification, they're gonna get no matter what. So with the good brushing and flossing, there is no problem whatsoever in placing the brackets higher. And the protocols. Like I said before, Dr. Pitts also developed a series of protocols. And with the orthodontic techniques and the strategy that he focused in achieving the aesthetic and functional results to our patients, combined with the Pitts 21 brackets, it's unbelievable what we can achieve. Seriously. I don't know about you, but in my practice, when I saw class 3s, open bites, I was just like, oh my God, can you call the other orthodontists? Like, they were very, very hard cases to treat. With the protocol, with Dr. Pitts' approach, everything became easier, okay? So you get a beautiful smile arc with more incisal display. The brackets, they're self-ligating, so there is much less friction between the wire and the bracket. So shorter treatment time, faster results, less appointments, and very predictable results, okay? Without saying that our wires, square wires, they deliver 30 to 40% less force with great control, comfort, and the sliding mechanics. So since our bracket system, is a square wire, the torque are different on the anteriors, premolars, and molars, you catch the torque right at the beginning. The second wire, you already have the control of that. So today I chose 3 cases, 3 class 3 cases, female, different ages, and different cases also. But I want to talk first about Eliane. So when you look at her malocclusion, we have an edge-to-edge bite. We have a class 3 molar right and left side. Posterior cross bite, right? And when she smiles, you see not a lot of incisal display. One thing I want to mention too is that I don't know if you guys have seen lately, but there's so many veneers being done by the general dentists, even like in very young teenagers. And I think this is happening because we are not being able to educate our patients by the power that we have with orthodontic treatment, especially with the Pitts 21 system, to deliver those. You're going to see the results of these patients that I'm going to show you. It looks like veneers. And I think it's a shame that all these young patients I have in veneers nowadays. You know, anyway, something artificial in your mouth that you can achieve naturally because maybe it's our fault. Maybe we're not educating our patients enough. And there's another thing that Dr. Pitts always talk about. It's about the power of the photograph. So I'm already, how can I say, I'm still working on mine because something hard to achieve. But if you have beautiful photographs, you can definitely share with your patients the before and after. And they, like this girl is an example, Eliane. She was so happy with her orthodontic treatment that she gave me a good review herself. So yeah, keep this in mind, okay? So let's continue then. So those are the initial occlusal photos, just mild crowding upper and lower arch. And we always do the aesthetic evaluation and, with our system. So we can take a look at the smile arc, right? It's not there. It's inverted. The incisor display also is not good. The maxillary transverse dimension, also she could definitely afford more expansion there. The upright incisors, we need to upright them a little bit more. And the microaesthetics. So this is the facial views and the profile. She has a very nice profile for a class 3 patient, actually. She's a beautiful girl. And this is the pre-treatment Panrex and Ceph, and you can see clearly that she is a class 3 skeletal patient. So then we do what we call class 3 early protocol. So plus mean that smile work protection is plus because, since she doesn't show a lot of incisors, we're going to place those brackets as high as possible. Okay, and this is the Dr. Pitt's protocol for the class 3. Then we flip the upper and the lower brackets. We use very short elastics right in the beginning of the treatment. We place the bar curves on the upper 5s when it's class 3s. And this early light elastics, you go from the 5s to the 3s, so you can maintain the expansion of the arch, okay? In this case, I also use cross elastics upper 5 to lower 6 and lower 5 to 6 to help correct the crossbite. And we do that really in the beginning of the treatment. So what I want to do now, I want to play a video. So this video is the class 3 protocol because since a picture is worth 1,000 words. You're going to see exactly what we do for the class 3 patients, okay? So as you see, this is the new bracket, the Pitts Pro. Fantastic, super comfortable for the patients, round edge, efficient. I absolutely love this bracket. So as you see, those are the measurements for the position of the brackets. And we disarticulate, as I mentioned before. In this case, we can also do the bar curves on the upper 6s. I didn't do for her, but it also depends if they have an open bite. We can also use that. So upper 5, lower 3s again, very, very light elastics since the beginning of the treatment. And these are the rainbow elastics. They are very helpful to help with the proclination, helping extruding the incisors to correct open bites or more incisor display if you need it. Just the tear and finish. And sometimes those cases can be done in 12 months. This is the way we maintain class 3s when patients still growing. Okay, so then we have LOR 1-year progress. And you can see in this photo, we already improving things for her. We can see more of her incisors now. The bite's not edge to edge anymore. And then this again show exactly what we just saw in the video, the class 3 elastics, the rainbow elastics were in the nighttime, okay? And we still have the crossbite on the left side. She was not very compliant with the rubber band, so you know how it is, and she grew far. Again, this case took me a little longer for those reasons, also because I bond the sevens in all my cases, so sometimes I'm waiting for them. So 1 year progress, you can see the little Kaplan books here where we hook the elastics. Oh, and I also place the tongue spurs. This is because, she had a tendency to place her tongue forward, and this way we can control, the tongue. So you can see 1 year progress looks so much better, like the incisors are showing more, it's happy. And here we have a 6 months progress, 16 months progress. And you see, I was not happy with the bracket placement. They were already high, but I even placed them higher. I really want to make sure that we are able to show as much incisors as possible. Then I reposition here my, you can see here I reposition upper 222, more gingivally. I flip low 222 here, and she continued the rainbow at 9 times. And the reason I flipped, because she had a very thin gingival tissue here, and flipping the bracket, I can tuck in that root a little bit more. And those are settling elastics here to settle the bites posteriorly with the class 3 vector. And then we have the occlusal progress in 16 months. Again, she has more Kaplan hooks there to correct her crossbite. And we are using our 2020 Ultra Soft Peaks broad. Upper and lower. Then again, the initial and the 6 month progress. Side views. We always like to take this 45-degree angle because that's when you can really see the smile arc here. And then is the 24 months. Sorry, I want to add one more month in her treatment. No. So you can see we got this beautiful smile. We call 12 tooth smile. I'll show you in the other picture. Again, didn't wear the rubber bands as much as I would like, but wow, she looks fantastic. So we are able to achieve, pretty much everything that I was trying to work in her case, the smile arc, the vertical incisor display, the maxillary transverse dimension. You can see she's much more broader smile, so much better. Upright incisors and microaesthetics we're able to achieve. So you have the 24 progress before and after. And again, beautiful bite. And the face, wow. Like the orthoped says, wow, I just love her smile. Like being able to see this, the second molar over there is great. And you can see here the radiograph. You can see like we improved the angle here of the incisors, class 3 still, but beautiful. And I refer her to extract third molars at this point. Again, we have the aesthetic comparison, the smile arc, we achieve the incisor display is so much better, broader arcs, upright incisors, and microaesthetics. See our final photos and before and after. So yeah, so this is the power of PITS 21 and the protocols. Then we have Mariana. Okay, Mariana is another Brazilian actually. She's 15 years old. Okay, and when you see, she presents with an anterior crossbite, posterior crossbite, severe crowding, right? And here we have the occlusal views. Again, if you take a look at this canine is completely blocked out. So if you get this case, if I get a case like that in the past, to be honest with you, I would think, oh my God, should extract a premolar. It's a surgical, all those things come to your head. But with the protocol, with the broader the broader arcs that we use now, wires and the self-ligating brackets, it's no brainer anymore. We just get those cases done with just brackets and wires. And see, again, I did the aesthetic evaluation. Again, smile arc's not there. Incisor display is even worse than LOA, right? The maxilla is very constricted. We also need to upright incisors and microaesthetics. And you can see, like, look at her lips, very, very thin lips, like pretty much collapsed vertical dimension, I would say, when you look at here, right? So let's see what I did. Okay, this is the panorex and Sap, and you can see here, right? The relationship of the maxilla, the mandible. You can see the mandible here, the anterior crossbite, lockout canine. Okay, treatment plan then. Same thing. We need the most amount of exposure of those incisors. So in this case, I placed as high as I could, but I'm going to share with you what I did to even place them higher. I really love this case. So if you see here, we did the bracket place, the same thing, flip the upper 222, start the short elastics, as and the same other case. The bite turbs, in this case, I put in the low ones because of the cross bite, and replace open coils, the 1s to 4s, to open up space for that canine that was blocked. We, of course, we use the upper and lower heat-activated Pitts Broad, 014. Then as the progress is 6 months. Actually, the crossbite got correct in 3 months, but I didn't have the photos. And it's another thing that I highly recommend for any one of you. You know, sometimes we have busy days, busy practice, and we don't have the time to take the progress records. But I feel the more progress records we take, the more we learn about the system, the quicker we can correct our mistakes, and the case, they go much, much smoother. So this is an anterior crossbite, again, that was correct in 3 months. And if you can see here, the 5's already erupting. I already have a lot of space for the upper right 3. And here we have, again, the occlusal views. I'm already like 6 months on the 2020 ultrasoft. It's broad, you know, 1818 and lower. The other thing about our system is we use very few wires. Like I pretty much use like 4 wires in my practice now. What makes so simple and convenient for the assistants, you know, it's so much easier now than it used to be before. I have I always tell my husband, I have few regrets in my life. And one of them was not to have used this system before. So, and again, let's proceed. So in this appointment, actually, you know, she was pretty anxious about the upper right 3. I thought I need more space, but I bonded on that appointment. I placed the 014, and I pigtailed to the 2020 on the upper arch. So this is the progress. I feel her lips look better already, you know? But let's see. And this is the before and after x-rays. Again, now the progress records 8 to 19 months in treatment. Then I bond the lower 5s, right? I place bite ramps. So what we do is the bite ramps before were in the lower ones, then I jump to upper ones. Because right now, what I really want in her case actually is more proclination of those upper incisors. And then remember I told you that I couldn't put the brackets high enough. Like if you see back here, see, I put as close as possible to the gum line. But what I did is, because I need more incisor exposure, so I laser upper 3 to 3, and I remove those brackets even higher. And I also add composing the incisor edge of 1s and 2s, okay? And I did the 2020 Pitts Broad. And this time she's using class 2 elastics. And wow, look at Mariana now, right? Look like another girl. And it's beautiful to see that the occlusion, you know, it's looking so much better. The position here of the incisors, the midline is almost on. It's 23 months in treatment. And then again, the frontal view here. So, see the canine is there, and the arch is very well developed. And this is 45-degree angle photograph. And you can see now the relationship of the arcs of the upper. And you can see like the occlusal plane also, how much it changed. It looks beautiful. So here's the 26 months progress, okay? So Mariana is supposed to be almost done, I mean, and she disappeared for a couple appointments, so I next time she has some settling alive, so I hope next visit I can definitely debond her. But for you to see, in this case, oh, this is the bike ramps that we transferred to the Apple ones that I mentioned before. But you can see now a different person. Look at that. Look at the lip projection. She has so much more lip now than before, just because of the system that we use. That we pretty much can do all cases, the majority of the case, I would say, without extractions. Unless really, the lips are too protrusive, then we can maybe go for the extraction approach. But, if you have a patient like Mariana with thin lips, with thin biotype, you're not going to do any favor extracting teeth on their face. And, our system with the protocols, we can definitely deliver. You can see the face. Say 0, 6, 23, and 26 months. Again, the photograph here. See? Those are my initial photographs. I improve a little bit, didn't I? Still in the search of the perfection. And you can see it's incredible the amount of space that was open for that canine. And everybody keeps talking about recession. Oh, if you don't extract this, it's going to happen, that's going to happen. I think most of the orthodontists actually are not paying attention how much bone we have here. Look, there's a lot of bone here, a lot of the bone there. This is not going to happen, as you see in the previous photos. Look at that. Everything is fine. So then the 26 months, probably initial 26-month project. The x-rays. And here's Mariana at 26 months. She's looking really good. I really like her smile arc. But as you see here in this photograph, we do have a midline discrepancy that I have the intention to address and make sure we finish her perfectly. So what I did is I placed a lingual button on the lower left 3, and we are running class 3 elastics through the bite to the upper left 5. And on the right side, we're doing class 2 elastics. And if your patient does a very good job wearing those rubber bands, you see we can correct that in a couple months. And here we have the occlusal views. Again, a very well-developed arch using our wonderful wires. See, we got a lot of expansion in comparison to the initial photographs. Here you can see the profile. I love the fact that her lips are more prominent, and the vertical dimension seem improved to me also. 45-degree angle photographs. The x-rays at 26 months. And finally, in 28 months, we have Mariana with this gorgeous smile, and she's super happy. And I don't know if I mentioned in the beginning of her case, but I remember the chief complaint was that mom was telling me Mariana never smiles, and Mariana tells mom it's because I have an ugly smile. And now, according to mom, Mariana cannot stop smiling, and that really makes my day, right? We feel so good when the patients feel happy, and again, they can smile freely. I mean, it's amazing. So I really like her occlusion on the right and the left side. You see these smile arcs there, full size of display. Occlusals. And we're able to achieve everything that we set up for in the beginning of her treatment. profile photos. And here we have the before and after. And again, you can see the profile was greatly improved with our treatment. Here's some progress photos. And you can see, like, in 2 months, we are able to address the midline discrepancy using the elastics and the lingual button on the left side here. And here you can definitely appreciate how much expansion was gained. And we make room for the block out upper Y3 and the beautiful arch form there we developed with our system. Here the before and after. And again, Mariana always smiles. And of course, I'm so happy for her. The initial and final x-ray. So you see the great improvement of the class 3 here. I think she's a little bit maxillary deficiency, but the class 3 was mainly because of also that block out canine. But if you see here, point A and point B, they look pretty good actually. And here initial progress and final photos. And wow, Mariana, she's always smiles now. She's a great girl. I really love this family. I treat her sister too. And here we have our last patient, Anna. So Anna is a 55-year-old woman, and I treat her San Daniel, and she really liked the results. And she asked me, do you think you can do that for me? Do you think I can, also have a brother and show more of my incisors? I said, of course, I can definitely do that for you. And as you see here, we have pretty much edge-to-edge overbite, moderate crowding on the upper and the lower arch, constricted maxillary arch. You can definitely afford more expansion and the maxilla, and the reverse smile arc that, right now I pay so much attention to. See what we're going to do. So here's the occlusal views, upper and lower. And the 45-degree angle, again, is a great photograph for you to pay attention at the smile arc. And in this case, you can see is inverted. Then we do the aesthetic evaluation, and she definitely needs some improvement with the smile arc, the incisor display. We want to expand more, upright the incisors, and the microaesthetics that she also needed. Here we have the initial x-rays, and you can see a little proclination of the lower incisors. And treatment plan. So for Anna, what I planned was, a very aggressive, what we call plus, right? Placement of the brackets as high as I could. And we're gonna start the short elastics right from the beginning. She does have the proclination of the lower incisors. So our goal is to use the class 3s also through the bite, the elastics, to kind of help with that, doing the development of the arcs. And we're using the upper and lower 1/4 pitch plus, because I want a lot of expansion for Anna. Then the IPR on the lower arch, as I mentioned before. And we're gonna do rainbow elastics. The rainbow elastics, they go from the lower 3s over the 1s to the other 3, like right and left side. And we're gonna use those at nighttime because we want an extrusion of the upper incisors, and also it helps develop the arch. And Anna also had, a lower forward tongue posture. So in order to address that, I placed some tongue tamers. So here we have the progress in 7 months. And then you can see we have the 2020 plus hits upper and lower. And you can see already a great improvement on her, on her smile arc. See they came down, and she's looking really good. Occlusal progress, you see the crowding was resolved. And here, the tongue tamers, I usually prefer to use the eyelids. I think it's more comfortable for the patients than the tongue spurs, and they do the same thing, pretty much. I think anything you place there would address the habit. And then here you have Anna on the 45-degree angle here. And 14 months progress. So Anna was so happy with the results of her incisor display. She said, "Oh, I think I look younger now." They actually asked me, "Can we go a little bit higher?" I said, "Yes, we can." So as you see, I reposition those brackets even higher for her. And in this photograph, you can see that we do have more incisor display. Here, what I have is what we call a torquing key. What we do is to control the proclination, we place the power chain under the brackets, okay? But you can see the smile arc is already developing here, and when she smiles, she looks beautiful. She's so happy with the results of our treatment. The occlusal views, upper and lower, in 14 months. And I do not have a 14 months photograph. I just have the 7 months on. So here you can compare like the initial, say 7 months, and the 14 months. And you can see that we definitely develop her upper arch. It's much more like broader now, and the incisor display it's beautiful. The 45-degree angle again, you can see initially she had a reverse smile arc, got better in 7 months, and even better at 14. So here we have like, the initial 7 and 14 months. You can see the great development here in incisor exposure. And again, we have Anna before and after, 0 and 14 months. And I'm planning to finish her treatment pretty soon. I think the next couple months she should be done. So my question to you is like, what all these women have in common? Okay, all these women, no matter what age they are, they want a beautiful smile. They want a smile that is gonna make them feel confident, that's gonna empower them just to be themselves. And we, as orthodontists, we do have the power to provide that to our patients, especially if we give them the smile arc and help them age gracefully. And Anna, I think, is a great example of this because you see, I think she gained a few years. She looks so much younger, just have more incisor display and a broader smile. So this is the power of PITS 21, PITS Pro, our system. And I just want to thank everyone for listening to this webinar. If you have any questions, please don't hesitate to reach out to me. The next PITS Masters is gonna be starting now in September. I don't know if they have any spots, but it will be worth to give them a call. Again, I highly recommend taking Dr. PITS Masters course. Again, thank you so much for being here with me today. I hope to see you another time. And here's my email and my Instagram. If you ever need to reach out to me, if you have any questions, I'll be very glad to help you. I hope you had enjoyed. Thank you so much. Have an awesome day. Bye.